Okay, so now we're going to start. Can I do the ground?
Yeah.
Now we're going to do the first real forearm technique. I'm going to show it to you in the kind of natural sequence of where you're going to usually use it. So you may start with an effleurage. And yeah, you just feel how is the tissue around? Or do they feel tight? Do they feel ready? Do they feel cold? It seems all right, you know. Right, you continue with some petrissage. Right, and when you do that, you always do and you always listen at the same time. So let's say that you start feeling on this area that is quite tight, okay? So you may decide, okay, I may want to do compression technique, but for now, I might start with the forearms, okay? So get some idea. Then is the time of preparation. So from here, you start thinking, okay, what would be the good position? First, I might need to straighten her hand a little bit so I can go closer to the table, okay? So I'm preparing. You see that my leg was here. It wasn't comfortable. I need to move my leg. All these small changes are the most important thing because it builds your body position. You see that I'm not directed exactly this way, but 45 degrees. My hip is not going this way, but it stays on both legs. I can always do it on both legs. Okay? Now, I kind of negotiate, yes? Okay, where I can put that, in here. Do I move? Not yet. If you want to come around, maybe it would be easier for you if you don't see. And then, once your position is right, only then comes the sinking in. Do it slowly. How's the pressure? Can I go deeper or?
It's a bit more. That's about it.
Okay. Okay, so I'm in the right depth. Now every movement I do should be minimal. It's really slow. When you're in a submarine, you can't move quick because you're deep. Okay? So now look very carefully to the little thing that I do now. I move backward, isn't it? And then my hand propel forward. That's it. No circus. Nothing really that looks out of the ordinary. And then you move with it. Okay? I'll stop here and I'll do it again because the initial is quite important. Okay? Now, you see, now I want to do the area below. The first thing that I need to do, move backward. Now, this is going to be too much. This is going to be too forward. So I need to really feel, and it's really the skill for the position that you need to feel, and then arrange yourself, relax this hand, put your hand on the other hand here on the forearm, but very relaxed. And then again sink. Once you're feeling that you're deep enough, then again you move a little bit, and that's it really. Then I need to follow it. So if I'll stay on the same place, look what happened very quickly. Whoop, too quickly. Why? I've left my body behind and it's getting to be, I'm too shallow. I'm like an airplane. Is airplane landing here, I need to kind of land from here all the time. This is crash. This is still landing kind of, but not too fast. If I want to stop here, all I need to do is bring my body forward and you stop. If I want to continue, I take my body backward. And if I want to stop, I stop. Okay? So you have the control over your body. If I feel that my hand is too forward, the only thing, look at my leg, I need to do is that. Okay, and then you continue. I just want you to practice here. Later we'll talk about the scapula that interrupting. Okay? You can try as well doing it on the opposite side, going downward. Again, sinking. And the quality really is relaxed. Don't use any force. Please don't use any force, because I want you to get it right, and it's not that easy. It's something quite settled, that you really don't need any force, only your weight. Honestly, only your weight. So stay with your weight, move a little bit backward, and wait a little bit. And then slowly it's really starting. You are, by putting your body in a different position, control. If you want to slow it down, you come forward. If you want to speed it up a little bit, you go backward. And it's quite small. This is forward, and this is backward. So if you do that, you overdid it. Yeah? Quite slow. Question? Anything? No?